The group that received the morphine by the doctor reported significant reductions in their pain levels. The other group, the group who received the same exact amount of morphine but wasn't aware of it, they didn't seem to experience the same benefit. So Dr. Benedetti and his colleagues didn't stop there. They used the same procedure to test the effectiveness of other treatments, treatments for anxiety, treatments for Parkinson's disease, treatments for hypertension. And what they found was remarkable and consistent. When the patients were aware of the treatment and expected to receive the benefit, the treatment was highly effective. But when they weren't, that same drug, that same pill, and that same procedure was blunted, and in some cases, not even effective at all. So I read about these studies when I was a student at Harvard University, and at the time I was heavily immersed into the literature on the placebo effect. And the more I read, the more I started thinking about the true nature of placebos. So what is the placebo effect really? Well, most people discount the placebo effect as just some magical response to some fake pill or some faux procedure. But that's not what the placebo effect is. The placebo effect is not about the faux pill or the sugar pill or the fake procedure. What the placebo effect really is a powerful, robust, and consistent demonstration of the ability of our mindsets, in this case, the expectation to heal. They dropped weight. They had a significant reduction in systolic blood pressure. They dropped body fat. And they reported liking their job more. So what does this tell us? Well, to me, it was fascinating that just as a result of a simple 15-minute presentation, the whole game changed, producing a cascade of effects on both their health and their well-being, presumably without even changing behavior. Now, some of you might be thinking, well, how do you know they didn't change their behavior, right? Because that must have been what produced the effects. Well, we know they didn't work anymore, and the room attendants themselves assured us that they didn't join the sports club down the street. Now, this would make good sense to any metabolic nutritionist who understands that the drop in ghrelin is proportional to the amount of calories consumed. But there was a catch. In this study, even though the participants thought they had consumed the sensible shake and the indulgent shake, in reality, we gave them the exact same shake at both time points. So what does this tell us? Well, just as in the case when the same amount of morphine produced more or less of an effect depending on our awareness, and just as in the case when the same amount of exercise produced more or less of a benefit depending on how it was construed, here again, our mindsets proved to matter. In this case, suggesting it might not be just calories in and calories out, or the precise makeup of fats, nutrients, but what we believe, what we expect, what we think about the foods we eat that determines our body's response. Because the true task ahead is to begin reclaiming this power for ourselves, to acknowledge the power of mindset, and know that just like this, in just the blink of an eye, we can change the game of any facet of our life quite simply by changing our mindset. Thank you.